Two more provinces have just released their projections for the spread of COVID-19 and the potential human toll. Saskatchewan estimates up to 8,300 people could die in the province, and Newfoundland and Labrador expects the outbreak to peak sometime between September and November. Those provinces join Ontario and Quebec, which have released their own projections. In about half an hour, Alberta will release its models, and we'll bring that to you live as soon as it happens. The Prime Minister has promised national projections are coming. No specific date yet when they'll be released, but here's what he said about it today.
We don't know exactly when we're going to be peaking, but we do know if we continue to do this, if we continue to keep the measures in place that we have right now, we will get through this much, much quicker.
So what exactly are we learning from the provincial projections? Is the peak of this near or still far off? Dr. Isaac Bogosh is an infectious disease physician and scientist based out of Toronto General Hospital. He joins us from Toronto. Hi, Dr. Bogosh. Good to see you again.
Hey, good to see you as well.
Okay, so I wanted to start off because I've just been following the press conferences from Newfoundland and Labrador and Saskatchewan. And the first thing I notice is the frame of reference for all the provinces' data that we're getting or the modeling we're getting is not exactly the same. So some are looking just at April, some are looking at the full spread of the pandemic. And as a result, we're seeing some say the peak is coming, for example, in Quebec this month. In Newfoundland and Labrador just said the peak won't be coming until the fall, they estimate. Can you help us kind of understand some of those differences?
Yeah, so I think there's a few high-level points. One is that, there's truly different epidemics happening in different provinces. Of course, we know we're all under the same umbrella in Canada, but, what's happening in British Columbia is likely rather different than what's happening in Newfoundland. And there's certainly local circumstances of how this infection was imported, where the hotspots are, how it's transmitted within communities. These are different across the country. Similarly, public health measures might be slightly different across the country as well in terms of the time they were implemented and the degree to which people are adhering to them. So we can't expect everyone to be in sync. In the same breath as well, there's different modelers in the provinces who are helping out with these local projections as well. So, you're going to have a different group of people in British Columbia looking at their local data coming out with their projections compared to a different group in, for example, Ontario coming out with their local projections. And let's just put that all into context for a second. Many people keep giving the Prime Minister a hard time about not coming out with countrywide projections. What do you expect them to do? You've got all the provinces working independently, coming out with provincial projections. It's not just a matter of getting a number and presenting it to the Canadian public. There's a lot of work that goes into this modeling, and they've got to look at different ways of data gathering across the provinces and put it together in a manageable piece. So I don't expect this to happen overnight. This takes a lot of let's put it this way, a lot of cognitive work into this from mathematical modelers and infectious diseases epidemiologists. This takes a bit of time, and I think hopefully there's some radical transparency. I like the way that Premier Ford did this in Toronto. He said something, or in Ontario, he said, "You deserve to hear what I hear," and I think the Prime Minister is going to do the same thing, but it's probably going to take some time before he has those numbers.
What are the factors that you would identify that most inform the projection where the peak is concerned? Because I think for a lot of us watching, that's the thing that jumps out at me, the idea that a few provinces over, it's not going to peak until September. Meanwhile, next door, it's going to peak maybe in the next week. What are the factors that inform that projection?
Well, one of the key metrics that I think is important to follow, of course, first of all, no one metric is going to solve the issue. There's always strengths and weaknesses for each metric. And really, it's going to be a combination of data points that are going to paint a picture. One of the more important ones is the number of new cases per day. And of course, we want to see a sustained reduction in the number of new cases of COVID-19 daily. But of course, we know that this can be altered by, for example, how widespread diagnostic testing is. And if there's, a quick expansion of diagnostic testing, that can muddy the waters. We're also looking at hospitalizations from this. We're looking at deaths from this. We're looking at your percentage, your ICU capacity, and how much of that is filled with patients with COVID-19 at the moment. There's a lot of different factors that go into it, and I think it's also important to note what are the public health policies that are in place, and to what extent are those being adhered to by the general population in your province. So, I think there's a lot of different factors that will play into when the peak is going to be, and also measuring how well different provinces are doing.
One province, Saskatchewan, said that it's too early to estimate even when the peak will be. Does that make sense to you as well?
Yeah, totally. I mean, they might not have enough data points. And, in total transparency, I have been following Saskatchewan closely. I should. But sometimes you need more data points to actually have a fair projection. And I think it's completely reasonable for people, if they don't have enough data points, there's no point speculating. You should be, when you're presenting this data, you should talk about the strengths and the weaknesses of the data and any assumptions that go into these models that you're parlaying to the general public. Because, many of the times we hear with these projections, we hear, here's the high, here's the maximum numbers of cases and perhaps the maximum numbers of deaths we're going to have. Here's the low, here's where we are. And hopefully we don't cut it in the middle. Hopefully we cut it down, of course, to the low end with our physical distancing measures and our hand hygiene and all these other measures that are being employed.
What about the way in which we might be able to assess whether or not the curve, quote unquote, curve is being flattened? And again, taking into account it's going to be different in each province. But in BC, for example, I noticed that it's not necessarily that there's zero cases or zero confirmed cases. It's that the rate of hospitalization or admittance into the ICU has either stabilized or marginally started to decrease. Are those the kinds of things that we're watching for in other provinces as well to try and assess whether that curve is beginning to flatten?
Yes, absolutely. And I think it's important that I know there's been a lot of back padding for British Columbia and Alberta, and clearly, credit where credit's due. They're doing better than most, but by no means are they out of the woods yet. And, it looks like those curves are flattening, but both of those provinces, even though they are leading the country in diagnostic tests per capita, make no mistake, they should still increase their diagnostic testing. They should still increase the testing in community settings outside of hospitalizations. And of course, credit where credit's due. They are leading the pack, and that's fantastic. We all should be improving on that front because it really gives us a better understanding of what the true burden of illness is in our respective provinces. But it also informs us as to how well we are flattening the curve, as it were. And, of course, we definitely want to see a sustained reduction in the number of new cases per day. But we also want to know that we're measuring what we should be measuring, which is, not just people that are sick enough to come to hospital or close contacts of those individuals, but also we should be measuring how much of this is in the community at large.
You mentioned diagnostic testing. I want to play for you a clip from Ontario Premier Doug Ford from a bit earlier today, and then get your take on the testing situation in Ontario. Let's have a listen to the clip.
No more excuses. It's unacceptable. We have the capacity now. Before, I understand, we didn't have the reagent. We didn't have all the testing. We have the testing capabilities. We have the assessment centers capabilities. We have the reagent. We say we can do 13,000 a day. Then we need to start doing 13,000 every single day.
So, Dr. Bogosh, we touched on this yesterday. This was sort of a very specific statement from the Premier today on it, following a number of days of reporting from my colleague Mike Crawley, in which he laid out that the province was falling short, basically, of the goal that it had set itself, which was 5,000 the processing of 5,000 tests a day. For example, on Tuesday, there was just 2,568 new test results provided. The capacity, the lab capacity, it was a backlog before, but now the lab capacity is said to be about 13,000 tests, which obviously, they're falling short of. What did you make of what the Premier is saying? And do you agree with the assessment that there needs to be a lot more testing specifically in Ontario?
Yeah, I mean, it's really nice to hear it right from the top. I think that's spot on. There is capacity, so why aren't we testing people? I mean, this is, it's completely the right message. I mean, they have overcome the hurdles of the reagents and having the right swabs and increasing capacity in the laboratories. There is unused capacity in the laboratories. We need loosening of the restrictions of who we can be testing, and we have to expand diagnostic testing in certainly in community settings. I think the hospitals themselves are actually doing rather well. I don't think there's any, if there are issues in the hospital, they're few. It really is expanding of diagnostic testing outside of hospital settings at COVID-19 centers, and really ensuring that people who have a compatible syndrome have access to these diagnostic tests.
And what about the criteria for the test? Because that has been very, very narrow because of the backlog initially in
'That's exactly it. And I think that should change, and it should have changed last week. And it certainly is time for that to change so that we can have a better appreciation of who has this infection. I mean, there's capacity to test them, so let's test them. It makes sense to me. And I think, we really need to rethink how we're doing this here so we have a better reflection of the true burden of illness really in community settings. That's really where this is going to play out. There's the capacity, there's the resources, and we're not doing it. And it's great to hear it from Premier Ford saying, what gives? We need to expand this. And I love that number of 13,000. I think that's a very appropriate number because that's reflective of the goals that they were setting earlier on. They said initially, about 2,000 or 3,000, then they wanted to expand to 5,000, then they want to expand to around, I think it was 13 or 14,000. He said 13,000 today. We're doing about 2,500 to 3,000 a day. I mean, we're far short of that. And we have to rethink who should be eligible for these diagnostic tests and ensure that there's access to these tests so we can actually have a better reflection of this infection in Ontario.
Before I let you go, Dr. Bogosh, just given all the statistics and numbers I think that are being thrown at Canadians over the course of just a few short days, what is the message that you think they should walk away with? What do you think should cut through all of the numbers that they're presented with?
We can't be complacent. Even though we're seeing early signs of success in many parts of the country, believe it or not, this is where the hard part actually begins. Because this is where we actually have to maintain these measures and maintain them for a period of time, probably for a month or two, depending on how we're doing. So even though there might be some early signs of success, it's too early to pat ourselves on the back. And believe it or not, I hate to say it, but this is just the truth. It's just going to get harder because we have to actually keep doing exactly what we're doing now for a period of time until we see a sustained reduction in the number of new cases. And how long does it have to be sustained for? Probably a few weeks before I think public health will even consider lifting some of these restrictions.
Okay, I'll leave it there. Thanks so much, Dr. Bogosh. Really appreciate your time as always.
Anytime.
That's Dr. Isaac Bogosh coming to us from Toronto. Newfoundland and Labrador is one of 3 provinces to release its COVID-19 projections today, but unlike other provinces, it does not predict a specific death toll. Instead, the government focused in part on critical care beds. It says it could run out of them by the end of June if the virus continues on its current trajectory. But health officials there do believe they have enough ventilators and regular hospital beds even in that scenario. So how will these projections dictate or inform the province's next moves? Dwight Ball is the Premier of Newfoundland and Labrador. He joins us from St. John's. Hi, Premier. Good to see you.
Good to see you too, Vashi.
Let's start off with what the model is projecting as far as ICU capacity, that the province will essentially exceed the capacity, or the need will exceed the capacity by the end of June if the current rate continues. What is your province doing about that?
Well, the current rate, of course, and I think Dr. Goldman just made some very good comments in your previous interview when he talked about the impact on Newfoundland and Labrador of the cluster at a funeral home. And that put Newfoundland and Labrador off to a very fast start in the number of positive cases per 100,000 residents of our province. So that have changed now considerably with the public health measures that we've been able to put in place. So when we talk about, the number of ICU units that we would have available to us, we must continue on with the measures that we put in place. For us, we see this as not a test of the system, but a test of people. The system will only fail if our people fail. So when you look at ICU as an example that you've just raised, we have the equipment here, so you can make ICU units available indeed if we needed that. But what we know with the current trajectory with the public health measures that we put in place, we can flatten this curve, but it will be a test of our people, not a test of the system.
And you are anticipating a peak before that flattening happens that's a bit later than other provinces. Can you explain why?
Well, what we know now, the public health measures that we put in place, they're very stringent, they've been very aggressive, and we put them in very early. And so for us, we're a little later, as we've seen with when we compare us to other provinces, we knew that. So we were able to get those measures in place, get them in quickly, as an example, stopping visitors to long-term care homes and acute care centers and so on. So we got those in early. And so right now we're hoping that those public health measures with the people of our province that are complying, in most cases, we do have some people that are not complying like we would see everywhere else. But it's important right now that if we continue to adapt the public health measures to our lifestyle, that we can actually push this out and we can flatten this curve, and that would keep us away from, what this surge and the peak as we continue to talk about. And the reason for that is we're planning, so as we continue to do what we're doing, we would have the capacity within our current healthcare system to actually handle the number of cases, positive cases of COVID-19.
When we talk about the number of cases, Premier, I'm wondering, it's a smaller sample, obviously. You have fewer cases in Newfoundland and Labrador, a smaller province than other provinces. Do you feel like the data that you base these projections on is accurate? Do you feel like you had enough to go on to make these projections?
Well, from a modeling point of view, of course. I mean, there were some qualifiers that we had to put in place. It's been independently reviewed, as the minister had just said. So what was important for us to get a message out, that if we continue to do what we're doing, complying with the public health measures, we can actually manage this within our current healthcare system. So that was a big message. But it means that we must be compliant and the people must be listening to what our public health officers are saying. So right now, that message for us, as we can continue to flatten that curve, we got off as a start, I would say, second only to Quebec in the number of cases per 100,000. Dr. Goldman just mentioned this early on as well. So for us, that cluster and preventing that similar type cluster from happening anywhere in our province again, not just in St. John's that we've noticed, but these types of clusters, if we don't comply with the guidelines that we put in place, they could occur in any community within our province. And so for us, it's around compliance. But the message, indeed, to all Canadians, it shows the impact that a cluster can have on a small community or even a large community. So this is where it's very important for us to be compliant with the public health measures.
Premier, there's a call tomorrow between all your counterparts across the country and the Prime Minister. What's your message to the Prime Minister in that call?
Let's continue to work together. And we know right now that, PPE is an important issue for all of us. We're seeing provinces that are stepping up right now. And so for us in Newfoundland and Labrador, as long as we can continue to flatten that curve, it would mean that, personal protective equipment would be available. We could see some of that being produced within Canada, which is important for us. One of the big lessons that we learn, I think, in this crisis will be that we must make sure that we prepare for emergencies and we're able to produce in our own country as much as we can to help our healthcare workers. We want them to be able to go to work safe and have the equipment that's required to do their work effectively. We're putting them in some situations that not many of those workers have been in before. So they go there, and we must make sure as premiers and as the Prime Minister, we must be there to support them in this very critical time.
What's the situation with personal protective equipment and the level of the supply of it in your province? I would highlight, just for example, that your health minister said that he was expecting a shipment of masks from Hamilton, courtesy of the federal government on Monday. Did those arrive? And what is the situation with the supply more generally in Newfoundland and Labrador?
Yeah, they're coming in, but of course you're never really fully satisfied with the amount that you've got in place, because we want to be able to put in measures, that we have, our healthcare workers, that they know that when they need that equipment, it's there available for them. It is right now, and we've been able to keep the supply moving. But we know there's a big demand on all of this. As we see provinces, primarily those in central Canada, there's a big requirement on this personal protective equipment. And so we know that right here in Newfoundland and Labrador, indeed, if we had to face a similar crisis, we want that available for our healthcare workers. So this is a message, that we continue to send to the Prime Minister, and we will do. We're providing areas right now in our own province that we're able to manufacture some of the, just retrofitting some of our own manufacturing sites to support what we need in our province as well. But it's a great example of everyone working together, and I think all provinces right now are willing to share, if need be, the resources that they have in their provinces, in their own particular province. So it's a big message to Canadians that we'll continue to work together.
Quickly, Premier, before I let you go, we've spoken often over the past month about potential help from the federal government for the resource sector, a sector, of course, that your province heavily depends on. Do you have any word from the federal government, again, on a timeline? Have you received any update?
Well, there's some, dialogue that's happening, and lots of meetings and chats, of course, on the importance of preparing this province and other provinces as we come through this health crisis to get into and deal with the economic crisis. The resources, that we've talked about, resource development is critically important for Newfoundland and Labrador. We are one of the provinces that are extremely dependent on natural resource development, and we will coming out of the health crisis, leading into the economic crisis. So we could not finalize, those discussions early enough to please me. Of course, we're anxious to know and be able to work with our industries that we have in our province. So they'll be in a strong position going in and leading the way in the economic crisis once we get through this health crisis.
Okay, I'll leave it there. Thank you, Premier Ball. Appreciate your time as always.
Thank you, Vashi.
Dwight Ball, the Premier of Newfoundland and Labrador. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.